Prof, a very good morning to you. The use of the word mutation, it immediately strikes fear, especially in the middle of a pandemic like COVID-19. Are there signs right now that the virus is changing in form and could potentially become dangerous?
No, we haven't got any data or any knowledge on that at all. Just going on purely virological principles, it's unlikely to kind of have the same mutation rate as we see with, for example, influenza or HIV. Those are highly mutable viruses. This, from a virological point of view, doesn't seem to have the same virological characteristics as those viruses. Having said that, of course, it did change when it came from the animal reservoir and crossed the species barrier, and then has entrenched itself in our human population. So the rate of changes probably won't be to the same extent as influenza, for example.
Prof, talk to us about how deadly this virus is. In Italy right now, we are reporting that it is wreaking havoc, and the number of deaths could actually surpass what was previously the epicenter, which was Wuhan in China.
Yeah, I think what we're seeing in Italy is really what we call an explosive epidemic. And this is really what we want to avoid in this country by being proactive, by putting those control measures into place. And I think the government must be commended, in fact, in doing that. We really want to avoid an explosive epidemic where the healthcare system can't cope with it. In terms of the what we call the virulence, in other words, the ability to cause severe disease of the virus, the kind of best data that we have up to now is in fact comes from China. And the majority of people, the great majority of people, in fact, probably won't see the virus as a serious disease. That's the kind of the bottom of the iceberg. Those that come to health care, in other words, those cases, we call that the case fatality rate. That's about 2 to 3% of those that come to medical care, those that have the disease. And of the people that have the disease, about 85% will see it as a mild to moderate disease. In other words, a bad influenza, a bad cold. 15% will require hospitalization. Of those, about 6% will need intensive care. In other words, will need a ventilator. Also, just remember that those that are hospitalized, there may well be long-term or permanent lung damage. So it is not a trivial disease. It's quite a serious disease. Probably not quite as serious as influenza, of course.
Prof, talk to us about what we have heard, and that is that the virus, this specific virus, can survive on surfaces for about 3 days at most. What is your sense? What have you heard from your side? Is it true that it can survive for a number of days on surfaces?
Actually, it's very interesting because a recent publication has just come out where they've in fact done that study at the National Institute of Health in America. And if I could just quote some of those figures, the virus in the aerosol, in other words, those droplets that you expire, that come from your mouth when you're coughing and sneezing and so on, in those aerosol, it's actually quite a labile virus. It'll only survive up to about 3 hours. But on surfaces, once it lands on the surface, those droplets land on the surface, then it'll survive for quite a bit longer. And it actually depends, interestingly enough, on the surface. And they've looked, for example, on a copper surface, it's up to 4 hours. On a cardboard surface, very much longer, up to 24 hours. And on a plastic or stainless steel surface, up to 72 hours. So it's quite variable depending on the kind of surface that the virus or the viral material lands on. It also survives for a longer period of time if the virus is in organic material, in other words, in the droplets itself, where the protein does appear to protect the virus. But up to about 72 hours, that seems to be the kind of upper limit.
Yeah. Prof, just as a final question to you, yesterday we listened to the Premier of the Gauteng province, that's where you and I are at the moment, David Makura, warning that panic will likely outrun our public health facilities. What's your advice to people who are experiencing flu-like symptoms at this moment in time on when exactly to consult a doctor to find out whether or not they actually may be infected?
Well, You know, there are three cardinal clinical signs of the disease. First of all, a temperature. Second of all, a sore throat. And thirdly, a cough. So those, of course, one gets with influenza, one gets with a common cold even. I think we also need a history that they've either come into contact with a patient who's got it, or if they recently come overseas where there is transmission of the virus. So we try to have both of those to actually have the case definition. It's not always easy, of course. And people that do feel that they will have the disease either because they've come into contact or they've got these clinical symptoms should consult their doctor and let him make the decision after he's taken a history and done an examination.
All right. That's a virology expert, Professor Barry Schoub, joining us via Skype. Thank you very much for your insights.